Good afternoon, everyone. So for today, we're just going to have a short lecture on electronic medical records. So for today, we have three cases, and we're going to illustrate three aspects of EMRs. The first case is entitled Rubik's Cube by Anudip Yalam of the University of Missouri. So this clinical vignette discusses medical errors due to problems with electronic health record notification resulting in a delayed diagnosis. Also, we're going to explore the different causes and their classification. Let's look at the case. Peter is a 64-year-old male with a history of hypertension and chronic kidney disease. She came to outpatient service with a history of generalized weakness and disease fatigability for 1 month. He is taking enalapril for his hypertension and atorvastatin for his high low-density lipoprotein. So ano nga ulit yung enalapril? Diba? It's an angiotensin-converting enzyme inhibitor. Papababa siya ng blood pressure. Yung atorvastatin naman is a hydroxymethylglutarate coenzyme A reductase, also known as an HMG-CoA reductase. Papababa yon ng tinatawag nating bad cholesterol or LDL. So ano yung mga in-order na diagnostic test? In-order yung CBC or complete blood count, complete metabolic profile, and renal function testing. The renal function tests were abnormal. Yung kanyang serum creatinine was elevated, 2.5. Ang normal ay 0.8 to 1.2 lang. Yung kanyang blood urea nitrogen or BUN is also elevated, 32 instead of the normal, which is 7 to 22 milligrams per deciliter. And also he had proteinuria. Normally dapat walang protein na madidetect sa dipstick. Pero yung yung urine protein niya is 3+. Okay? So on review of records, it was noted that the lab results were reported in the EHR. However, the physician failed to follow up on the results because the EHR did not alert to abnormal results. Because of this delayed the staging of his chronic kidney disease and appropriate management. So this case illustrates the fact that even if meron ka ng high-tech na electronic records, it doesn't mean na perfect na agad yung system. So dito nga, yung simpleng setting lang ng alerts or alarms kapag meron kang abnormal lab results, 'di ba? It could already affect whether madadiagnose quickly or slowly yung sakit ng pasyente. In this case, the error is one of a missed notification. Yung abnormal lab results were reported electronically, but the physician failed to follow up kasi nga naman marami siyang inaisip pa siguro or nakalimutan niya na meron pa siyang hinihintay na lab result. The EHR did not alert the physician to the abnormal results, and this delayed the staging of the chronic kidney disease and appropriate management. The delayed diagnosis could have been prevented if the physician had direct access to the primary report. Kasi nga naman, noon kasi diba traditionally, yan piniprint pa yan manually, tapos inaabot pa directly dun sa ward. Pero in this case, sa electronic health record na lang. Another thing that could have helped was if there were automated notifications. So, follow-up of laboratory test results is a major patient safety concern. Electronic health records were initially implemented to improve patient safety. However, take note that even if they are high-tech, no? And even if they are high cost, it doesn't mean that they are exempted from safety issues. Kaya nga meron tayong tinatawag na rise of iatrogenesis. Ano ba yung iatrogenesis? Iatrogenesis means errors or problems that arise from healthcare-related issues. And in this case, kahit electronic pa yan, yung healthcare na yan, there are still safety hazards. So, despite their benefits, electronic health records have introduced potential safety hazards referred to as iatrogenics. These errors must be proactively addressed as EHR adoption increases. And there are two types of EHR-related errors, system-related and user-related. Let's start first with system-related errors in the next slide. System-related errors could be intrinsic to the design, or it could be related to the alarm system. So let's look at the first case. So technical and design issues because electronic health records involve complex software that are prone to numerous bugs and glitches. So ang problem pa dyan minsan, parang specific lang yan sa service provider nyo. No? So kung halimbawa, nagkaroon ng glitch, kailangan mo siya itawag doon sa company nagpo-provide ng service. Hindi siya kayang ayusin ng hospital IT ninyo minsan kapag hindi siya gawa in-house. Ha? So examples niyan, missing or corrupted data that could display lab results incorrectly. Another thing is that there may be a failure or lack of alerts and alarms. So proper alert systems are mandatory to prevent adverse outcomes. You could imagine a case in which nagkaroon ng drug overdose ang isang baby due to a transcription error. Dapat technically, kung maganda yung system ninyo, dapat check na rin nila properly kung yung mga dosing ba ay yung associated sa tamang gamot. So halimbawa, kung furosemide halimbawa yung gamot, kapag na-input mo 400 milligrams instead of 40 milligrams, dapat mag-a-alarm na yung system nyo kung maganda yung setup ng alarms niya. Diba? So these are system-related errors. Let's look now at user-related errors. So even if your system is perfect, errors could result from improper use of that system. And usually this happens due to complexity, inadequate training, or non-user-friendly interface. Okay? So let's look at some types of user-related errors. So we have 4 here. The first one is copy and paste errors. Inappropriate use can result in inaccurate and false data entry, leading to poor decision making. Nangyari yan kapag kinaka-copy-paste mo na lang yung old na notes mo. Halimbawa, kasi naman, di ba, nag-chart ka yan every day or every duty cycle mo, di ba? Tapos, sometimes, if copy-paste ka ng copy-paste, hindi mo mapapansin na nagbago na pala yung status ng patient. Meron pa lang ng bago sa case niya, nag-improve na pala siya or lumala siya. And kapag kinaka-copy-paste mo lang yung ginawa mo previously, this could lead to error. So, for example, copying an old note lead to a near miss and changing an antibiotic regimen for a patient whose condition has already improved. Next would be templates. Okay? So, iba-ibang tawag niyan per department. Pero yung narinig ko ng ibang tawag dyan, parang lyrics, no? Yung parang template na nila. Tapos, kapag ito yung sakit, halimbawa, pag ito yung diagnosis, ito na agad yung chart nila for that patient. Although that's good technically because it improves efficiency, but in the wrong hands, it could cause unintended consequences. So, for example, an amputee's electronic health record noted that his extremities were normal because a standard template was not modified. Okay, so kapag ganon, putol na pala yung paa, tapos nakalagay pa rin doon sa peripheral vascular examination niya halimbawa ay normal, no? Yun. Kailangan mo kasing edit yung mga template na yan. So in the next slide, let's look at error types 3 and 4. Next would be clinical decision support system. So sometimes yung mga electronic health record, meron na siyang built-in interpretation systems. Halimbawa, sa laboratory mo, yung ibang health record management systems, meron na siyang automatic na alert kapag elevated or mababa yung lab values. However, ang problem doon, minsan, that could lead to an automation bias. So, what happens there is that users follow the system prompts even if it contradicts their medical knowledge. So, kumbaga, mas nagtiwala na yung clinician doon sa sinasabi ng system. Ano ba yung mga example ng cases na pwedeng mali yung system? Halimbawa, kung doon sa automated lab report system, kung pediatric halimbawa yung patient, tapos ang nakalagay na normal values naman usually kasi sa basis ng mga interpretation ng lab results ay pang adult. So kapag ganon, kapag may hindi siya tugma, pwedeng mali yung i-notify ng clinical decision support, di ba? So another example halimbawa is if merong automated na interpretation yung EKG or ECG. Tapos yun, kapag mali interpretation ng computer application, pag in-interpret yung conduction block as normal kahit hindi naman pala, then that could lead to errors. And lastly, we have alert fatigue. So this concept is somewhat similar to our alarm fatigue na discuss natin earlier, di ba? If there are too many alerts, if there are excessive alerts, and if they are of little significance, they may cause the users to ignore the actually important notifications. So for example niyan, pag yung physician gumagamit ng isang system in which lagi na lang siyang tumutunog ng red, no? Tapos umiilaw-ilaw, kahit yung mga simpleng typographical errors lang, no? So, na-miss out niya nung nangyaring mali na talaga in-input niya critically. Nung nangyaring maling dose yung nilagay niya for penicillin, na-miss out niya na nag-alarm for that thing. So, in other words, kapag mag-set up kayo ng electronic health record system, dapat there are just enough alerts and alarms para ang ko-consider lang doon is kapag critical na. Let's move on now to our next clinical vignette. So this one is entitled A Hurried Miss. And here, we're going to discuss how to mitigate EHR-related errors. So this vignette is going to discuss a case where an echocardiogram report was not fully read due to its presentation on the EHR. This resulted in a preventable stroke. We'll also explore ways to mitigate such errors. The case of Sid, a 34-year-old male. So, ganito yung nangyari. A 34-year-old male presented with an increased heart rate and shortness of breath. An echocardiogram was ordered. The provider read only the conclusion part of the report. So, yung nasa dulo na lang, yung nakalagay na impression, yung interpretation nung nung tagagawa, no? So because of that, na-miss niya yung mention of mild mitral stenosis kasi naka-embed siya in the detailed body of the report. Because of that, the patient was discharged with the diagnosis of panic attack. So, akala nila psychological na problem. Because of this, ang outcome, a few months later, the patient returned to the emergency room with a stroke. A new EKG and echocardiogram revealed atrial fibrillation and severe mitral stenosis. So, structural pala yung problema. Doon pala siya dun sa heart valves as well as dun sa heart rhythm. The stroke could have been prevented if the initial finding was not missed. So how could we prevent such EHR-related errors? So we have two resources here. So SAFER Guidelines and AHRQ. So the SAFER Guides were developed by the Office of the National Coordinator for Health Information Technology, while the AHRQ produced guidelines for reducing unintended consequences of EHR. So both of these are resources found in the US. So sa Philippines, wala pa. But specifically, what are the concrete ways to reduce electronic health record related errors? First is yung mga design related errors. So sa mga system related errors, you should need to establish industry standards as well as federal regulations for approval and monitoring. So dapat meron tayong mga batas, no, para siguruhin na yung mga binibenta sa merkado na mga systems are meeting certain standards. We should also enforce vendor adherence to safety optimized design. So dapat yung mga pagbibilihan natin ng mga system na to, hindi basta makabenta lang. Dapat high quality. Dapat may improve talaga ang patient safety. So next, how about for user-related errors? So usability in HR certification should be ensured through user training. And also, there should be an internal reporting system for errors. So, ibig sabihin lang yan, kapag sinecertify yung mga EHR na binibenta, yung mga system na for sale and for adoption, no? So, dapat isa sa mga kinoconsider yung usability. Hindi sapat yung utility lang. Hindi sapat na fit for function lang siya. Dapat madali rin siyang gamitin, no? So, dapat compatible din siya with the users. Also, kapag mag-a-adapt ng bagong system, dapat merong user training. Kasama yon, di ba? And lastly, dapat merong internal reporting system. Ibig sabihin nun na may way to give feedback yung mga gumagamit sa frontlines. Kung sino yung actually na gumagamit, dapat pakinggan sila ng management. Okay? Next, documentation recording process. Highlight pasted material. Adopt a zero tolerance policy on unethical copying and create policies to discourage copying for productivity. Although, as I have mentioned, yung copy-pasting nga ay good for productivity in a sense. That's error-prone, di ba? Kasi kadalasan nakalimutan na, dahil naging automatic na lang copy-paste, nakalimutan na i-correct yung kina-copy-paste. So, one of the ways to discourage that would be to highlight kapag copy-pasted yung section na yon. No? Para kapag nag-copy-paste ka sa Wikipedia, di ba? Obvious, kasi lalabas siya. So, pag copy-paste mo halimbawa sa Word. Okay? Also, yung mga nasa management din, they should be reminding the residents to avoid unethical copying ng chart. Lastly, for alerts, nabanggit na natin yung concept of alert fatigue, di ba? Dapat yung mga alerts and alarms should be only for important events. Kasi otherwise, they could overwhelm the users with less important notifications. Kapag oras na para dun sa error na kailangan talaga ng proper action, doon na hindi makaka-respond properly yung resident. Okay? So that's it for case 2. Let's move on now to the last vignette of this lecture. So this is our final case for our short lecture. This is clinical vignette 3. Title is A Case of Mistaken Identity. This vignette discusses a case where a report was sent to a different provider due to patient misidentification, resulting in worsening of her disease symptoms. So ito, kahit electronic na, kahit automated na, pwede pa rin siyang prone to errors. We'll also discuss the role of federal initiatives in patient safety. Federal kasi US-based yung ating reference for this course. So this case is of Mary, a 60-year-old female who came to the outpatient clinic with numbness and tingling of the lower extremities, along with painless ulcers in the bottom of her feet for 6 months. She has a history of diabetes for 10 years, for which she's using insulin regularly. Upon physical examination, muscle tone, bulk, strength, and deep tendon reflexes are normal bilaterally throughout. So wala namang muscle problem. On sensory examination, there is decreased sensation in the feet till below the knee bilaterally, as well as decreased sensation in the hands bilaterally. She has steppage gait, negative Romberg sign, normal finger to nose test. No? So hindi naman cerebellar problem. Pero meron siyang steppage gait, probably because of peripheral nerve weakness. Because of that, A1C was ordered. So iniisip, baka may diabetes siya, baka ito ay isang diabetic neuropathy. Also, nag-order din ng NCS-EMG or nerve conduction studies with electromyography. NCS-EMG was done outside by a specialist, and the results were sent to a different provider because of the patient's first name mix-up. Yung kasing Mary na name is very common. Because of that, the patient's primary care physician never even received the results. After a couple of months, the patient again saw the primary care physician, but now with worsening of her symptoms. So this case will provide us an opportunity to examine the identification mix-ups within EMR, as well as their impact on patient safety. So in this particular case, it doesn't mean na EMR yung nag-fail. Instead, the errors were because of a lack of proper safeguards against misidentification, as well as weak linkages of the electronic health records. Dapat, the system has to be in place so that the EHR can alert the provider or technician on misidentifications. Halimbawa, meron ka pangalan yung pasyente. Dapat, nag-notify yon para hindi malilito yung mga titingin. So, in order to provide the patient safety, quality, and efficiency of healthcare organizations, health information technology was mandated by the Federal Incentive Program. Okay? So, it defined MU, which is a program in 3 stages for timely adoption of EHR use. Discuss natin yan in the next few slides. However, despite the widespread adoption of EHR in the US, only few hospitals have met all the criteria because the implementation and development is still an ongoing process. Okay? So data and overall improvements are yet to be determined and documented. So in the US, they have this HITECH Act. HITECH stands for Health Information Technology for Economic and Clinical Health. So there, pinaprescribe yung widespread adoption and use of electronic health records. Tapos doon, meron dinedefine na meaningful use or MU. So yung MU na yon, ang goals would be to improve quality, safety, and efficiency for the protection of patient health information, pero dapat meron pa rin patient and family involvement, coordination of care, and population and public health. Also in the US, merong batas na tinatawag na MACRA, Medicare Access and Chip Reauthorization Act of 2015. So there, sinasabi lang na merong merit-based incentive payment system. In other words, hindi na paramihan ng patient yung reimbursements. No? Instead, pinaprioritize na rin yung quality. So pay for performance. And ina-assess yung performance based on these 4 things. So, quality, clinical improvement activities, advancing care information, as well as cost. So, hindi na sapat na paramihan lang na nagagawang procedure. No? Nitingnan na rin yung quality. So, what did we learn today? So, in conclusion, Electronic health records have the potential to improve and transform healthcare. However, hindi nawawala yung two types of error na nabanggit natin kanina, di ba? System and user-related errors. Therefore, we need a multifaceted approach, improving system as well as robust user training. And on top of that all, nandyan yung mga batas, intelligent policies. Yung mga nabanggit na nga ating batas, di ba? Meaningful use because of the High-Tech Act and MACRA. They push the industry towards better quality and accountability. Okay? So moving forward, we need continuous collaboration between lawmakers, yung nagbebenta ng EHRs, yung vendors, as well as the healthcare providers, yung mga hospital and yung mga doktor na administrator. And the end goal, of course, is to ensure safer systems and better patient care. That's just it for this lecture. It's just very short, but if you have any question, once again, you're welcome to message me. Thank you, everyone.